this meeting, we're presenting data on 136 patients. And these were patients with relapsed refractory myeloma, which was exactly the case in the 012M study. But in this study, the vast majority of these patients are triple class refractory, and a significant portion are what are called penta-refractory. So they're refractory not only to IMiDs, proteasome inhibitors, but also to daratumumab or other CD38 targeting antibody therapy. And the majority are what we call penta-refractory. In other words, they've had all best IMiDs, all best proteasome inhibitors, and daratumumab or isatuximab. So what was very interesting in this study, with this relatively simple regimen, using this drug administered monthly until progression and/or intolerance, we saw on the one hand encouraging safety information. In other words, we saw manageable suppression of blood counts, no hair loss, minimal mucositis. I mean, really just a very small number of patients with only grade 1-2 toxicity, no peripheral neuropathy, and a generally very manageable safety profile. The efficacy signal, however, was what really has caught our imagination, and that certainly is a solid 30% response rate in this very heavily pretreated population. And most importantly, when we look at the extramedullary disease population, of which there are a significant number in this trial, the largest number in any prospective trial in this particular setting to date, what we see there is that there is a solid response rate overall, again, of around 30%. Interestingly, in the extramedullary disease that's arising from bone, the response rate is a little higher. From the soft tissue only disease, it's a tad lower, but the bottom line is, for a single agent, we're seeing a level of activity between 20 and 30% across the board that is not seen with other single agents in this space.